Welcome to this educational video on bladder septation. In this video, we will explore the causes, symptoms, diagnosis, treatment, and management of this relatively rare congenital anomaly affecting the bladder. Join us as we delve into the complexities of bladder septation and understand how it impacts individuals. The exact cause of bladder septation is not fully understood. However, it is largely considered a congenital condition, meaning it develops during fetal development. It arises from incomplete fusion or abnormal development of the bladder's embryonic structures. Genetic factors may also play a role in some cases, but more research is needed to confirm specific gene associations. Certain environmental factors during pregnancy could potentially increase the risk, but these are not definitively established. Bladder septation involves the presence of a dividing wall, or septum, within the bladder lumen. This septum can vary in size and thickness. It can be a partial septum, incompletely dividing the bladder, or a complete septum, resulting in two separate bladder cavities. This abnormal division can obstruct urine flow, leading to urinary stasis, increased risk of urinary tract infections, and potentially damage to the kidneys due to backflow. The degree of obstruction and the resulting complications depend on the size, location, and completeness of the septum. Bladder septation is a rare condition, and precise epidemiological data is limited. Its occurrence is estimated to be in a small percentage of congenital urinary tract abnormalities. It is important to note that due to its rarity, large-scale population studies are challenging to conduct. The condition can affect both males and females and may be diagnosed at any age, although it is most often detected in infancy or childhood during evaluation for urinary tract symptoms or other related conditions. The signs and symptoms of bladder septation can vary depending on the severity of the condition and the degree of urinary obstruction. Some individuals may be asymptomatic, particularly if the septum is small and does not significantly impede urine flow. However, common symptoms may include recurrent urinary tract infections, frequent urination, difficulty urinating, a weak urine stream, incomplete bladder emptying, dribbling after urination, and abdominal pain or discomfort. In severe cases, hydronephrosis, a swelling of the kidneys due to backflow of urine, may occur, leading to flank pain and potentially kidney damage. Diagnosis of bladder septation typically involves a combination of imaging studies and clinical evaluation. Ultrasound is often the initial imaging modality used to visualize the bladder and identify any structural abnormalities. Voiding cystoarthrogram, or VCUG, a type of X-ray that captures images of the bladder while it is filling and emptying, can help assess bladder function and identify the presence of a septum and any associated reflux. Cystoscopy, a procedure involving a small camera inserted into the bladder, allows direct visualization of the bladder lining and confirmation of the septum. Further imaging like CT scans (MRI) may be utilized for more complex cases or to assess related anatomical abnormalities. Bladder septations can be broadly classified based on the extent of the septum. A partial septum only partially divides the bladder, leaving some communication between the two sides. A complete septum fully divides the bladder into two distinct compartments. The septum can also be classified by its location and thickness. Furthermore, bladder septation can occur as an isolated anomaly or may be associated with other urogenital abnormalities, such as duplicated collecting systems or ureteral ectopia. The primary goal of treatment for bladder septation is to relieve urinary obstruction and prevent complications. The specific approach depends on the severity of the condition and the patient's symptoms. In asymptomatic cases with minimal obstruction, conservative management with regular monitoring may be sufficient. However, symptomatic cases usually require surgical intervention. The septum is often surgically resected, typically through a cystoscopic or open surgical approach. The goal is to remove the dividing wall and create a single, unified bladder cavity, thereby improving urine flow and reducing the risk of complications. Post-operative care involves monitoring for infection and ensuring adequate bladder emptying. Currently, there is no known method to prevent bladder septation, as it is thought to be a congenital condition arising during fetal development. Prenatal care is essential for the overall well-being of both mother and child, as are discussions with your doctor about any family history of congenital anomalies. Further research into the genetic and environmental factors involved in bladder development could potentially lead to preventative measures in the future. The prognosis for individuals with bladder septation following surgical correction is generally good, particularly when the condition is diagnosed and treated early. Successful resection of the septum can alleviate symptoms and reduce the risk of long-term complications such as recurrent urinary tract infections and kidney damage. Regular follow-up with a urologist is crucial to monitor bladder function and detect any potential issues. Recent research has focused on minimally invasive surgical techniques for septum resection, potentially leading to improved outcomes and reduced recovery times.